In this lesson, we will cover what causes Chiari symptoms, the most common symptoms, the Chiari headache, the cognitive and psychological impact of Chiari, and pediatric symptoms. One of the more complicated and confusing aspects of Chiari is that it can cause many different symptoms, and for some patients, it can seem like Chiari is impacting every part of their body. In addition, while some symptoms, such as headaches, are very common among Chiari patients, Chiari affects everyone differently, meaning for some people, headaches are the worst issue, but for others, it may be balance problems. A 2004 study documented the wide variety of Chiari symptoms in dramatic fashion. The research involved over 250 Chiari patients, from as young as 12 to as old as 78. In all, 13 different symptoms were reported by at least half the patients, and 95% of the patients reported 5 or more Chiari-related symptoms. The reason behind the wide variety of Chiari symptoms is that it can affect the brain and nervous system in several different ways. These include compression of the cerebellum. The cerebellum is primarily thought to be involved in voluntary movement, balance, coordination, and walking. However, recently, the cerebellum has been found to be important for many higher-order brain functions as well. In Chiari, the cerebellum is squeezed through the opening in the bottom of the skull, which can impact its function. Compression of the brainstem. The brainstem is located at the top of the spinal cord and sits next to the cerebellum. When the cerebellar tonsils are herniated, they can push directly against the brainstem. The brainstem controls many automatic bodily functions such as breathing, sleep, heart rate, internal body temperature, and digestion, and having something pushed against it can disrupt these important processes. Compression of cranial nerves. The cranial nerves are nerve fibers that originate in the brainstem and are involved in eye movement, hearing, facial sensation, swallowing, and head and neck movement. With Chiari, these nerves can get pinched, causing them to not work properly. Disruption of the flow of cerebrospinal fluid. As we learned earlier, cerebrospinal fluid flows naturally back and forth between the brain and spine. However, Chiari blocks this flow and basically clogs it. The potential negative effects of this are not known. Damage to nerves in the spinal cord. Chiari can damage nerve roots in the spinal cord, leading to chronic pain, loss of sensation, and weakness in the arms, shoulders, hands, and legs. Once you understand what Chiari can do to the nervous system, it is easy to see why it can cause so many different and serious symptoms. With that in mind, next we will focus on common Chiari symptoms. This diagram shows the 10 most common Chiari symptoms among adults, according to the Chiari 1000 patient database. Let's take a closer look at some of them. At the top of the list are headaches, suffered by 95% of Chiari adults. As mentioned previously, the classic Chiari headache is an intense pressure in the back of the head brought on by activities such as coughing, straining, singing, laughing, going upstairs, and even standing up. However, some Chiari patients feel more pressure behind their eyes than in the back of the head, and still others may suffer from headaches that are more like migraines in addition to or instead of the classic headache. It is worth noting that while the classic Chiari headache may not last long, it is incredibly painful and can feel like your brain is being crushed, or conversely, like your head is going to explode. Just behind headaches in terms of frequency is neck and shoulder pain. The nerves associated with the neck and shoulder are at the top of the spinal cord and can be damaged in Chiari. This can lead to chronic pain, muscle atrophy, and loss of function. In addition, some Chiari patients may suffer from cervical instability in this area, meaning that when they move their neck, the vertebrae of the spine become misaligned, which can also cause pain and other problems. Nerve damage to the neck and shoulders due to Chiari can lead to long-term problems and disabilities. With all that is happening with Chiari, it might seem natural that it would be common for patients to have trouble sleeping, but the sleep issues associated with Chiari go deeper than that. Research has shown that sleep apnea, where breathing repeatedly stops and starts during sleep, is common with Chiari. In fact, one sleep study found that 73% of adult patients and 60% of pediatric patients met the criteria to be diagnosed with sleep apnea. While more than 80% of adult patients report trouble sleeping, formal sleep studies to identify apnea are not generally part of the Chiari testing regimen. One set of symptoms that are very common but don't get as much discussion are eye and ear problems. Visually, Chiari patients can experience involuntary rapid eye movements and are often sensitive to bright lights. It is also common for Chiari patients to suffer from ringing in the ears, pressure in the ears, and sensitivity to loud noises. Relatedly, Chiari patients often have balance issues. The human balance system, also known as the vestibular system, is complex and involves the eyes, the inner ear, the brainstem, and the cerebellum. Given that all of these can be compromised with Chiari, it is not surprising that patients struggle with balance and walking. And in fact, research has shown that balance issues can be an objective indicator of Chiari. For many years, despite patients talking over and over about suffering from brain fog, cognitive issues associated with Chiari were not taken seriously by the medical community. However, in the past several years, research spearheaded by Conquer Chiari has shown through a series of projects involving imaging and cognitive testing that Chiari can, in fact, have a significant impact on memory, executive function, and other critical thinking skills. Similarly, the psychological effects of Chiari have only recently been explored, but the mental health impact is profound. Conquer Chiari research has found that high levels of depression, anxiety, and loneliness are common, with one researcher equating the situation to what is seen with post-traumatic stress disorder. In fact, research has shown that Chiari patients are at an increased risk of suicidal behaviors. Finally, let's focus on pediatric symptoms. While children and adults share many Chiari symptoms, there are some differences in which ones are the most common. For example, young children under the age of 6 often suffer from throat-related issues, such as trouble swallowing, gagging, reflux, hoarseness, chronic cough, and failure to gain weight. Among older children, scoliosis, an abnormal curvature of the spine, is often seen in association with Chiari. While scoliosis among adolescents is a common finding in general, Chiari patients often have unusual curve patterns which are indicative of an underlying neurological issue. When it comes to what first concerned parents about their child, both seizures and developmental delays have been reported as the primary reason they started looking for a diagnosis. Similarly, parents of infants have reported head banging by their child was the first indication they had that something was wrong. In this lesson, we learned that Chiari patients suffer from a wide array of symptoms, and Chiari affects everyone differently. Symptoms can involve problems with the cerebellum, the brainstem, cranial nerves, spinal nerves, and disruption of the flow of cerebrospinal fluid. The most common symptom is headaches, especially those in the back of the head caused by coughing or straining. Other common symptoms include neck and shoulder pain, sleep apnea, balance issues, vision problems, and auditory issues. Recently, Chiari has been shown to cause both cognitive and psychological problems. Throat issues are very common among young children, while scoliosis is common among adolescents.